I'm Dr. David Hill, and today we're going to talk about how to recognize signs of an ear infection in a newborn. Now, I think we need to distinguish here because ear infections in newborns are very, very rare. I don't think I've ever seen a real one in my career. They tend to occur in later infancy. Usually ear infections may start as early as 4 to 6 months of age. They become more common later in infancy, so that by age 9 to 12 months, it's not at all unusual to see a baby with an ear infection. But in the newborn period, in that first few months of life, it is really quite rare to see a true ear infection. There are some signs of illness that do worry us. A baby who is eating well and stops eating well is always concerning to us. A newborn who has any fever, any temperature over 100.4 degrees rectal is always concerning, especially in the first month of life. That is a medical emergency and needs to be addressed immediately. But really any time in the first 3 months, that needs to be addressed very quickly, because sometimes a fever is the only sign you get that your newborn infant is gravely ill and needs to be treated in a hospital. So if you find that fever, don't think, oh, my kid's got an ear infection. In the first few months of life, that is absolutely not a safe assumption. A baby who seems fussy, inconsolable, just can't stop him from crying, can't be woken up. Again, I wouldn't jump to the conclusion that that's an ear infection in a newborn infant, because there's a lot of other nasty things that can be going on, and your best bet is to bring that infant or newborn in to see his or her medical provider. Now, later on in infancy, after the first few months of life, the baby may actually be able to reach up and pull at his or her ears, probably not before 4 months of life, more commonly 6 to 9 months that they can do that. And some babies never do pull at their ears, even when they have rather bad ear infections. Another sign to look for is fever. After the first few months of infancy, fever is not considered an emergency. However, a fever over 104 degrees is always concerning. A fever over 105 degrees deserves immediate attention, not because the fever is going to hurt the baby, but because you really want to know what is the source of this fever, what's going on. Any fever that lasts more than 3 days needs to be checked out. That's how long we expect a normal fever to last from a cold or viral illness. And any fever that has no explanation in an infant, that is, a baby under 12 months of age, always needs to be evaluated. That can be a urinary tract infection or another more serious infection. So, talking about how to look for signs of an ear infection in your newborn, I am Dr. David Hill.